Cerebrovascular accident, or CVA, also known as stroke, is a brain attack. The stroke occurs when blood vessels carrying vital oxygen and nutrients to the brain burst or become blocked by a clot, causing part of the brain to die. Some risk factors are age, race, smoke, hypertension, high cholesterol, and people who are diabetic. Hello, Mr. Gomez. My name is Hector, and today I'm a bio clinician, okay? Let me review your medical history form, ask you a couple of questions, and then we take vitals, and then after that, we start with the procedure, all right? Let me review your medical history form. So we got your whole information. I see that you circle you have high blood pressure, and you take Norvasc for that, correct? You also circle that you have high cholesterol and you take Lipitor for that, is that correct? Okay. Do you have any allergies? No? Alright. Are you diabetic? Yes. Type 1, type 2, you know? 1. Alright. I see that you circle that you use tobacco products. Do you smoke? Do you chew? Do you smoke it? How often do you smoke? Just a few times. Alrighty then. Let me take the vitals. Cool. So after taking your vitals, Mr. Gomez, I see your blood pressure is a little elevated. It's 135 over 85. I don't see no complications during the treatment, so we can start with our procedure, okay? So after reviewing his medical history form, I will classify him as a SA3. Mr. Gomez, are you okay? What's going on? Your head is starting to hurt? Just half of it? Your eyes, you have blurred vision as well? So some symptoms of stroke include a huge headache, blurred vision, loss of consciousness, and confusion. Some signs of stroke will be half of their face will droop. He will have weakness on his limbs, and he's gonna have trouble seeing with one or both eyes. So in this occasion, my patient is from stroke, and half of his face will droop, and his speech will be unclear, okay? The faster you act, the better they have a chance to be rescued. Once you recognize the symptoms and signs, you should do the CVA ACT technique. That stands for F, stands for face asymmetry. You ask your patient to smile, and you don't want to see half of their face droop. A stands for arms. You ask your patient to raise their hands and notice if there's any weakness or they cannot raise their arms on the same level. Also, S stands for speech. So you ask your patient to repeat a simple sentence, and if they can, then that's one sign of stroke. And then T stands for time, which you call 911 for the patient. So once you recognize the symptoms, if you're in the clinic, you active code blue and call 911. After you recognize the symptoms, you lay the patient in a supine position like this. You administer oxygen from 4 to 6 liters. Monitor their vitals, and then you wait for the EMS. You're gonna be okay, sir, okay? We already called 911, so you should be back soon. If the patient goes unconscious, you repeat the same thing. You wait for the EMS, you provide BLS until EMS arrives. You administer oxygen and monitor the vitals and put them on a supine position. So something that I could have done differently to prevent this emergency from happening is that I could have made the patient's appointment shorter, or make an appointment with whenever they feel more when it's more convenient for them. Also, I could have provided with some anti anxiety meds to prevent the patient's blood pressure, or to keep the stress minimal. That way their blood pressure doesn't go up.